Hello. So, in today's video, we're going to discuss a bit about history taking. So, let's discuss the basics of history taking today. First of all, when you enter the room, you need to greet the examiner and you have to mention your GMC number and your name. Once you sit down, you have to greet your patient. And how you need to greet your patient is just say hello and wait for the patient to reply. Then introduce yourself, for example, mention your name and the department that you belong to, and then ask for the patient's introduction. Ask for how the patient would prefer you to call him or refer him to, and then mention the purpose of the consultation. Now you need to ask the patient why did the patient feel like coming to you to the hospital, and make sure throughout the consultation and throughout your introduction you have a slight smile on your face just to make sure that you provide a pleasant environment to the patient. In case of a follow-up patient or in case of a follow-up consultation, you need to make sure that you already have the purpose of the consultation with you outside the cubicle. So you have already been given that, and since you have it, now you have to mention it. You don't ask patient how you may help the patient. Instead, you mention the total purpose which you have been given outside the cubicle, and you have to state that. For example, okay, so I understand that you have come here for a follow-up, and you were here in the hospital 5 days ago. So you did have some investigations done, and we do have the results with us, so I see that you're here for the results. So am I right? And then you have to move on to the prior understanding that the patient might have for the last consultation he had. So here you will be discussing how was the consultation and what did you talk about, and what was the matter which brought you to the hospital, and what investigations were done, how what treatment you were provided with, how was the whole experience and everything. You can just take the basic history of the whole thing. And again, you should have a slight smile on your face while you're at it. Moving on, there are two things that you need to keep in mind when you're taking the history of presenting complaint. For example, if it's pain, then you need to follow Socrates. However, if it's any other symptom other than pain, you have to follow Odipara. So let's discuss what each and every letter in the mnemonic actually means. Okay, so when we're discussing Socrates, S stands for sight. So you need to ask the patient where the pain is exactly is. You can ask the patient to point at exactly where the pain is, and then moving on, you have O, which stands for onset. Onset means that you need to ask when and how did the pain start. So did it start suddenly? Did it start gradually? How many days or how many hours it has been, whatsoever? And then moving on to the character. So you need to ask what kind of a pain is it? Is it dull? Is it sharp? Is it compressing? Whatsoever it is. Then moving on is radiation. You need to ask if the pain goes anywhere else. For example, if the patient comes in with chest pain, does it go anywhere else, to your arm, to your jaw, or anything? Then A stands for any fact aggravating factors, anything which makes it worse, and anything at all which makes it better. So you need to ask about aggravating and relieving factors as well. And then you have to ask about the associated symptoms, which is anything else along with the pain. For example, fever, vomiting, diarrhea, or anything. And the timing, when throughout the day, is there a specific time when the pain starts and goes, or it's again the aggravating and relieving factors. And then finally, the S stands for the severity or scoring of the pain. So you need to ask the patient, so can you score it for me for on a scale of 1 to 10, 1 being the lowest and 10 being the highest. And if the patient mentions over here that the pain score is more than 6, then you need to offer the patient some painkillers, or you can always go ahead and ask that, I can see that it's a lot of pain. So do you need some painkillers, or are you comfortable to continue the consultation? Because patient could be in so much pain that he won't be able to answer all your questions, or he might not be comfortable at the moment. So you need to offer some painkillers as well. Next, let's discuss Audipara, which is a mnemonic you need to follow for any other symptom that comes up other than pain. So S stands for frequency, which means that you need to ask the patient how often does the symptom comes and goes. O again stands for the onset. Did it come suddenly or gradually, and when did it happen? Duration means since when it has been happening. Then P stands for progression. Um, which means is it getting worse? Is it getting better? Is it the same? A stands for any aggravating factors, anything which makes it worse. R stands for relieving factors. Is there anything which makes it better? A stands for any other associated symptoms that might be there along with the primary symptom that the patient is experiencing at the moment. Then you need to, in case if there is vomiting or sputum or any kind of discharge, you need to ask three things or four things regarding that. So you need to ask about the timing when it happens. For example, if it's sputum, then you need to ask what time of the day does it is it more often, or what time of the day do you feel like you're having sputum with your cough. How much is it? Can you like quantify it for me within cups or spoons or something? And what color is it? Is it red? Is it colorless? Is it green? Do you see any streaks of blood, anything at all? Then the contents, which means that you need to ask the patient, what do you see in that? For in sputum, you can, just like I mentioned, that are there any blood clots or anything? So in such cases, you need to ask these four questions, and also its relation with the primary symptom. For example, if the primary symptom was cough, then you need to ask, does it come with the cough, or is it always there, or like what's the relation is it having with the primary symptom that is present at the moment? Then one of the most important things over here that you should remember is flaws. Flaw stands for, F stands for fever, LA stands for loss of appetite, W stands for weight loss, and S stands for sweating. Now, these are a few questions that you may ask in every other scenario that you come across, just to make sure that you're ruling out any kind of infection and any kind of cancer. In cases of cancer, if you know that the scenario given to you is regarding a cancer, then there's one more question that you need to add, or you can add, is that if have you experienced any lumps and bumps anywhere in the body, because it's more specified towards cancer. So just add this one more question in case that you strongly feel that it might be a cancer scenario. All right, so once we're done with the history of the presenting complaint or the presenting symptom, let's move on to the differentials. Now, the differentials are, of course, going to be varying according to every symptom that's going to be there. For example, in case of red eye, it could be conjunctivitis, it could be glaucoma, it could be scleritis, it could be subconjunctival hemorrhage, anything at all. It could be giant cell arteritis. So, in such cases, when it comes to differential, I would highly recommend that you have your differentials arranged in a manner that the most important, or the red flags, or the ones that are more life threatening, should be coming at the top, and from that you should be going down towards the bottom, which are not so necessary for you to ask, because in the exam you have only 8 minutes to complete your station. So if you ask too many differences, then you won't be able to save yourself a lot of time to complete the management. So you don't need to ask all of them, but you need to have at least 4 and 5 on your fingertips, which are the most important ones. So always make sure that you arrange your differentials in a way that you have the red flags on the top. So first of all, ask the red flags or the most life threatening differentials that you have in your mind. For example, in case of a GCA, you can ask about scalp tenderness, or you can ask about headache along with the eye pain. Ask those questions, ask one to two questions regarding each differential, and then move on to your systemic review. So a systemic review is not important in all of the scenarios, but some scenarios such as dermatology, you may, or pediatric, may need to ask all the symptoms, a few symptoms which are coming from all the systems there. So it's really important in those cases, otherwise it varies from station to station. Now, moving on, another mnemonic that you need to mention when you're taking the history is meftosa. Now, meftosa is one of the things that do save you in the exam if you are unable to make your diagnosis, because there's something given to you which would be there in this mnemonic that will help you uh, lean a bit towards your diagnosis. So M stands for any medications or many medical conditions that the patient is suffering for. So you can ask that a simple question such as, is there a medical condition that you have been diagnosed of? And are there any medications that you're taking regularly? Any medications that you've been prescribed, or any over the counter medications? Then A stands for any allergies. So, do you have any allergies to any medications or any food? And then F stands for family history. So, ask about family history. Is there a medical condition which runs in your family? T stands for travel history. There are going to be times then where this is the only thing which is going to differentiate two things, which may be an answer to your scenario. So, never skip Miftoza. So, have you traveled anywhere? What do you do for a living? This is also something which does give you an idea about your diagnosis. So again, this is also one of the important questions. And then about the social history, which means that ask about drinking habits. Do you drink alcohol? If yes, how often? And how much do you drink? And then, do you smoke? Since when have you been smoking? And how much do you smoke in a day? So these are a few questions that you need to ask in order to make sure that you're getting everything out from your history, because your diagnosis really, really depends on how good your history is. So try to make sure that you ask good questions from your miftosa, because that is really going to help you in your diagnosis. So, moving on in social history, you can also ask about the patient's life regarding his life at home. So, who do you live with? Are you married? Do you have any children? Um, and ask about stress in life. So, is everything okay? That's the only thing. That's like you can ask in particular, is everything okay? Or in general, you could um, just say that, all right. So, I'm hoping that everything would be fine at home. All right. So, moving on, a few questions that you need to elaborate on when it comes to a chronic symptom, which means a symptom which has been there for more than a few weeks, more than 4 weeks at least. You need to ask DESA, right? So, smoking alcohol, you're already asking. But in addition to that, you need to ask about the patient's physical activity and discuss a bit on the diet that the patient is taking. Because in cases where the patient present to you with a certain symptom which has been there for like 2 to 3 months, it's definitely going to be affecting the patient's life overall. And the patient's diet and physical activity might be having an impact on that. So you need to ask about this as well. Moving on, ICE is one of the most important things which helps you score well in your IPS. All right. So I stands for the ideas. Is there anything you feel could be wrong or could be causing your symptoms? Do you have any concerns with specifically which you might be worried about? And then expectations. Ask about the expectation towards the end of the consultation. Do remember over here that when you're asking about the concerns, and if the patient mentions any concern but you're unable to address it at the moment, make sure that you address it towards the end of your consultation, because in case you forget about it or you're unable to address the patient's concern, you will not be able to pass the station. So make sure that you do so. And yes, make sure that you always address the concerns of the patient. Now let's look into the effects of the symptoms that the patient is having on his life overall. So, if there's a lifelong or if there's a very chronic symptom that the patient is suffering from, there is going to be a good effect on his psychological or mental health, and also in on his social life. So, always try to ask about that. So, are these symptoms having any effect on your life at all? Is it affecting your work? Is it affecting your life at home? Is it affecting your relationships? Is it affecting your mood in any way? So you can always ask about that by asking a simple question such as, can you please, how is it affecting your mood? Can you please score your mood on a scale of 1 to 10, 1 being the lowest and 10 being the highest, just to make sure that it's not affecting the patient's mental health a lot. Because again, this is um, one of the components of the patient's health that you cannot ignore. In case of a female, you need to ask questions regarding four things. We will discuss these further in our lectures regarding gynecological history, but just to mention it, you need to ask a few questions regarding the patient's cycle, menstrual cycle, ask about pregnancy, ask about the pills she might be taking, and ask about the pap smears that she might have had so far. So, and also, if the patient has been taking any medications at all, as we have already discussed in Miftoza, you need to ask about the medication. You need to ask the details regarding the medications. So, what medications have you been taking? How long have you been taking that? Are you taking it regularly? Is it affecting the condition for which you have been taking it? All right, so once you're done with your history, now you need to move on towards your examination and your observations. So before doing so, you can just summarize everything that the patient told you, or just take up the clinchers that the patient gave you throughout your history and mention them so that the patient is able to understand that you were actively listening to whatever the patient was telling you. So once you're done with the summarization, now you can move on to your management. That is all for history. Thank you so much for watching. And if you have any questions, you can always refer to PLABQuest1 at gmail.com. Thank you so much.